I think first we have to congratulate Ayo for being able to make it to the studios in Lagos, and he'll be joining us on this conversation. But right now we're going to be focusing on health. We're changing attention to health. We know that about 29% of all deaths in Nigeria today are caused by non-communicable diseases, which is where family physicians come in. A lot of people do not know much about family physicians. Have you bothered to check your health status this year, throughout the year? Did you have time for a health check? As the year is coming to an end, is this something you're going to prioritize, even as we hope to travel and spend more time with family members? But this is what Dr. Ngozi Mamelu, who is the Chairman, Society of Family Physicians of Nigeria, FCT Kefi chapter, is here to discuss with us this morning. It's good to see you. Compliment of the season.
Yeah, thank you very much for having me.
I think we're very well, you know, and instead to say that now, because we're already almost, is it about a week to Christmas?
Yeah,
as a matter of fact, it's exactly a week to Christmas.
Wow.
Yeah, exactly.
Yeah.
Today is Wednesday. By next week, Wednesday, we're looking at Christmas. So, indeed, compliments once again to you.
I wish you the same.
I'm wondering, I mean, you are the Chairman, Society of Family Physicians of Nigeria, and that's not something we hear very often. Family physicians.
What's a family physician?
Exactly.
We have personal doctors.
Exactly.
Yeah. But what's a family physician?
Who are they?
Okay, so thank you very much for that question. I'm excited to be talking about family medicine this morning because it's something that I've always wanted to clarify. A lot of people don't really know who family physicians are. So we are those specialists that you can call us the gatekeepers. You can call us the first contact care physicians. So we offer comprehensive, coordinated, and continued care to individuals irrespective of the agenda. By that I mean we take care of people from cradle to grave, and then we also take care of undifferentiated pathologies. People come to us, they don't have a diagnosis. We are the ones that put it together and then refer to other specialists. And we do this in the context of the family. We are very family sensitive, family centric. That's who we are.
So rather than having a physical physician, is it appropriate to say you can have a family physician?
Yeah, that's who we are. We are family physicians. We take care of, as a matter of fact, we take care of 80% of the problems that patients present with 80% of the time.
So is it someone that cares for everyone in the family?
Yes, exactly,
unit?
everyone.
So you cater to the peculiar needs of the family. So if there's diabetes somewhere among the parents,
exactly,
and high blood pressure somewhere, then you have to check that and then make sure the children are...
Exactly. That's exactly what we're talking about. So that's why I said we cater for undifferentiated pathologies. We offer holistic care. When patients come to us most of us stay at the general outpatient departments of hospitals. That is what we do. We offer preventive, promotive care and also health education. That doesn't mean we don't make diagnosis and we don't treat. That we actually do comprehensive care for our patients. You know? Yeah.
Well, I mean, I don't know, from what you have seen, from your own experience, would you say that Nigerians are very health conscious, especially, you know, when it comes to family health? Is this something that do they really take, you know, getting the indices, knowing what their health status is? Do we take it seriously enough?
I don't think so, because I know that if we should take the blood pressures of all the people in the studio, it will surprise us to know that a lot of people don't know their health status. A lot of people may be diabetic, may be hypertensive, and they don't know that. And that's why you see that a lot of Nigerians are slumping and dying. People go to bed, they don't wake up. People don't know their health status. And that's what we are advocating for. People should come to the hospital, not just when they are sick. People should come in when they are healthy to know their health status. And by the time people start doing this, the health indices of this country will change. As a matter of fact, family physicians, our main area of care in Nigeria is the primary health, you know, systems of the country. So you see that in countries like UK, France, Cuba, they've gotten this right. They understand the need of family physicians to take care as gatekeepers in the health systems. So by the time countries like Nigeria start doing that, we'll see a total improvement on the health status of the country. So people have like an apathy, you know, like when you say you're going to the hospital in Nigeria, people are like, is it that serious? So we want to change that narrative. We want to change that mindset. We want to encourage people to come, to the hospitals and get their health status known.
I mean, you mentioned earlier, you mentioned primary health care.
Yeah.
And just so you know, for those of us in this studio, we have regular checkups on Channels TV to make sure that we are healthy before we get on this job.
Okay.
But I wanted to talk about the relationship between a family health physician,
family physician,
and primary health care centers across the country. You do outreaches at local levels and things like that.
Okay, that takes me to what our society is all about, the Society of Family Physicians of Nigeria. So part of our mandate is to ensure that the family physicians take over or supervise the primary healthcare systems in the country, because we want people to have accessibility to health. We also want the universal health coverage. That's a burning issue now, so that people can get access to very excellent care. And we also want to sustain an effective healthcare system in the country. So our major area is the primary health care. So if family physicians take care of primary health systems in the country, there'll be a drastic improvement in the primary healthcare systems. Yeah, thank you.
I'm sure Ayo would like to pop in now.
Well, thank you, Malkwe. Straight to the issues. You talked about NCDs, non-communicable diseases, and a good number of people will probably even be wondering what we are talking about here. So it's easy for anyone to do a quick Google search, and perhaps the challenge really is we don't even know what they are and how. It may sound simplistic, but if you can just take us through them, what they mean. We have a vague idea of what communicable diseases are. Things that can be caught. Non-communicable, probably those that cannot be caught. But then, is it really that simple?
Thank you, Ayo, for that. You've actually made my job easier, because non-communicable diseases, like the name implies, are those diseases that are not communicable. They cannot be transmitted from person to person. They run a long, like a chronic course, and they have huge health consequences on not just individuals, but the community and the society at large. So those diseases are things like the cardiovascular diseases, like the hypertension, like the strokes we know about, and that, like the myocardial infarctions that people say they have heart attack. And they also comprise of the chronic pulmonary airway diseases and the cancers, so those are the major non-communicable diseases. It's interesting to know that some of these things can be prevented, because when you talk about the non-communicable diseases, you have the modifiable and the non-modifiable risk factors. So the modifiable risk factors are those things that you have control over. For instance,
we'll come to those
diet,
details.
People should eat healthy.
My apologies, madam. We'll come back to those issues. But just to be clear, because there are those who would say, and even some of your colleagues in medicine have told us that sometimes a disease like hypertension, though not communicable, could actually be genetic. So it's not that this fellow wanted to have it, but somehow it just happens to be in their blood or in their lives or in their system, somehow. Help us understand that.
Okay, fine. Thank you very much for that. So suffice it to say that non-communicable diseases actually are an interplay between the genetics, like you rightly said, and then your environment or your lifestyle. So these people actually have the genes to develop high blood pressure or diabetes or asthma, as the case may be. But what actually brings it out is your lifestyle. For instance, I'll just give you a simple example of diabetes. If you have the genes in your body, you have the diabetic gene in your body, and you have like a lifestyle that you take a lot of sugary things, you're most likely to burn out the little reserve of the insulin that you have in your body, and that would now predispose you to having the diabetes manifest. So what we actually do is that we counsel patients, we talk to them about healthy living, so that we can push this illnesses as further away as we can, so that people may never come down with it, even though they have the genes, because it's not everybody that has a gene for a particular illness that will manifest with the illness. So by the time we, as family physicians, you come to us, we do the health education, the health promotion, the lifestyle modifications that we offer our patients, you will find out that some of these patients may never come down with diabetes, in their lifetime.
Okay, well, that's one down, so to speak. But then there is also mental health disorders on the list, so to speak, because now there are some things you just can't do anything about. But then when the realities hit you, you are susceptible, so to speak. So you can't, some of these issues you can't really preempt. You can't preempt a job loss. You can't preempt the landlord suddenly having a problem and consequently giving everybody in the house, an exit letter. Some things that could spike mental health issues in anyone. So how do we manage? How do people preempt? How does family health physicians help in that kind of situation?
All right, thank you for that. I would agree with you that there are certain things in life that you can't predict. What matters is how you're able to cope with the stresses when they come. For instance, in family medicine, we are very patient-centered. We actually want to know who has the disease than what disease the patient has. So we actually do a patient-centered model of care, where we try to carry the patient along, understanding the patient's illness experience and all of that. But the thing about mental illnesses is that we all are stressed, and some people have the genetic makeup for certain mental health illnesses. But what really matters is your ability to contain the stress when they come up, and that's where we come in. There is stress management. We know that the country at the moment is not very conducive for a lot of us, but we try to do family counseling. We try to find out what those problems are. We try to profile solutions, because when you solve these problems, because most times stress actually aggravates mental health issues. So family physicians have a pivotal role to play, because we do a lot of counseling for our patients. We try to connect them to services that will help them manage their situations better. For instance, a patient may come to the hospital with headache, and a lot of physicians would, take history, examine the patient, do the necessary investigations, and then go ahead to treat the headache. But as a family physician, we really want to understand what is causing this headache. By the time we take a family and social history of this patient, you may find out that it's a job loss that is causing this headache, because the patient may have gone to several hospitals and the headache persists. And people will start doing very high investigations like the CT scan. We're not saying that is wrong. But if you don't solve this problem, if you don't go into the dynamics of the family to find out that this man may be having marital problems with the wife, or he may have lost a job, and then you address that. When we have such situations, we actually invite the family, because we do family counseling. So we sit the woman down with her husband, and we try to solve the problems of the family. And in doing that, a lot of stress is reduced, and people can now function better. We also link them up to services. We try to find out what skills can you do, assuming you don't have a job, We try to link them up. So we think family as family physicians. Yeah, thank you.
I know that there is little that government can really do we can't legislate lifestyles. We can only try, government can only try with policies and initiatives that can help to navigate. Please tell us about the NCD policy, if Nigeria has any, because I know that it's one of the things that, one of the efforts that government has made to try to manage it, tobacco taxes, tobacco advertising bans, tobacco health warnings, and all those things. Tell us about some of those things and how impactful, if at all, they have been over time.
All right. Yeah, I totally agree with you that governments should actually improve on the policies. They are already doing a lot. I don't know if you're aware of in October this year, there was a campaign, a Project 10 Million campaign that was initiated by the Commissioners of Health and the Governors Forum of Nigeria, where they said, know your numbers, control your numbers. So it was targeted towards people actually knowing their health status. Come check your blood pressures, come check your blood sugars, and then let's see what we can do to help you manage these things better. So that was very commendable. That was something that should be encouraged. So aside that, there should be infrastructural development. Like in Abuja, when you see parks, people go there to eat, drink, and all of that. It should be beyond that. They should have recreational parks where people can go exercise, jog, to improve their physical health. That's targeted towards reducing the non-communicable diseases. And again, what you're already doing now is apt, because this is a health awareness, this is health education. People are listening in, they will pick one or two things from what we are discussing. And then there's also capacity building. Government should continue training and retraining of healthcare workers in order to ensure that they have good control, they manage the NCDs better. And of course, you've already talked about the legislation on alcohol. Tobacco, a lot of places now, you can't smoke in the public. So that also gets towards, reducing the NCDs. And then research. In Nigeria, there's actually paucity of data. We don't really do a lot of research in Nigeria. And you can't make informed choices, informed decisions if you don't have the right data, because data is life. That's what people say. And that is true. So if we need to start looking at research, go across the country. If you go online now, for instance, you see a lot of countries, they talk about their statistics. But in Nigeria, we are trying, but we can actually do better. So these are some of the things that we can improve on to ensure that this menace is curbed. Thank you.
Just one last one from you, madam. Tell us about the age standardized rates, particularly for NCDs, and if there are, maybe you may also want to mention the major ones, and also maybe help us understand the numbers per gender, the quantum of male. There's a data I'm looking at right now from 2021 that says that NCDs was responsible for the death of 565 out of 100,000 men and 556 out of 100,000 females in 2021. Is that something you can corroborate? Has it gotten better since or worse?
Okay, yeah, that's what you said is actually true. For instance, globally, NCDs account for over 70% of the deaths in people aged 30 to 70. That's quite significant. Even in the country, NCDs account for over 30% of all deaths annually. And we are looking at the fact that it's been projected that by 2030, NCDs will cause up to 15 million deaths annually, and that's quite alarming. And that's why bodies like the WHO and the World Bank are intensifying their efforts in the control and prevention of NCDs, and is a burning issue on the global health initiative here for now. That's the figures I can give you. Thank you.
Oh, well, I mean, quite a lot to actually mull over. I don't know what you want Nigerians to really take away, this holiday season, especially as they party, as they will be making merry.
They drink a lot and do all the unhealthy things together.
Yeah. What message do you want them to keep at the back of their minds?
Okay, like you rightly said, the festive period is time for partying, for a lot of drinking, a lot of smoking for those that indulge in that. So as a family physician, I'll first of all tell them to come first to the hospitals to have themselves checked. Those that are healthy
to the hospital.
Yes, they should for a health check before the drinking. So you need to know your health status. That's
so you know how much you should drink.
Yeah, because it's what they call responsible alcohol intake. We won't go into that now, but they should know their health status, because that's the basis. It's only when you know a patient's health status, an individual's health status, that they can advise better. So they should come around, feel free to have themselves checked to know if they are hypertensive, if they are diabetic. For instance, if they are diabetic, they should stay off the sugary drinks. It's a no-no. You can't take all those sugary drinks. So then those of them that already are hypertensive, they should also come so that we know how controlled their blood pressures are, the diabetes is, and all of that. There are screening tests that we do for all ages and gender. So we should start from that. Then we should also educate them that here, the festive period is a good time to party with family members, to bond with family members. But first, you have to manage stress. We talked about stress management. There are a lot of expectations during this festive period. People go out of their way to do all manner of things to get money and try to impress people. Don't impress anybody. Be yourself. People say cut your coat according to your size. I say according to your cloth. I say cut your coat according to your size. If that cloth can give you a tie, please do a tie with it. Don't go thinking you want to do a suit and then you start burdening yourself. There'll be other Christmases. That's my message to them. So whatever you can do now, start early to plan to do it better by next season. And then stay away from tobacco. Tobacco is a no-no. Studies have shown that one stick of cigarette is enough to cause all the harm that, the body does not need. And then you also need to do responsible alcohol. Alcohol is not bad for the system, but there has to be control. You have to actually cut down on alcohol. And then the food, eat healthy, because there's going to be a lot of eating at this period. Family, friends will bring all manner of things, jam, fried things. So try to eat healthy. It's always better to boil rather than fry. If you can grill, that's also good. So try to, and exercise, because you're going to be eating a lot of things. You're going to be drinking a lot of things. Make out time to incorporate physical activity in all that you do. And lastly, drugs, your medications. For those of us that are hypertensive or diabetic, don't forget to take your medications so that you don't come back with worse complications than you went with. Yeah.
That's a conversation to have before we travel. Okay, let's go and check how much alcohol you can take. Let's see where your kidneys are.
Let us hope that the prices of alcohol too will also discourage people from consuming so much. But yes, I'm sure you know by now that we care about your health on Sunrise Daily, and we want you to have a very healthy Christmas while you also make merry. So please, do take all that she has said very seriously. Dr. Ngozi Mamelu, we have to thank you so much for coming on Sunrise Daily this morning. She's the Chairman, Society of Family Physicians of Nigeria, FCT Kefi chapter.
Thank you
once more.
Thank you.